Welcome to the Bright Insight Digital Health C-Suite Series. I'm Chitra Nawbatt. Joining us today is Dave Matthews, Chief Growth Officer, Bright Insight. Dave, welcome. Thank you for joining us.
Thanks for having me.
Launching and scaling digital health solutions, very difficult. You've been in this industry for many years, 15 plus, consulting at BCG to the top pharmaceutical companies, now Bright Insight. What's your advice?
It starts with the product and the patient. So when I think about what challenges there are in adoption and what opportunities there are, it all starts with understanding the patient journey and what are the patients really suffering from? What are they challenged with? What are the frictions in their care? When we start programs, when we work with biopharma, we always start with what is the patient dealing with? What are they solving for, right? And when we can focus everything around what the patient experience is, that's when we can build the best digital programs, and the adoption comes as almost for free, right? You build the right product, and the right product will actually continue to get adopted by patients, even through word of mouth, which we've seen in several of our products.
So what's your specific advice if you are, because there's many stakeholders involved in this, right? There are the digital leaders, there are the IT leaders, there are the commercial leaders. What's your advice to each of those constituents?
Yeah, so digital and IT folks often are really interested in product, and they often have a remit though that is focused on kind of the proof of concept or just the initial prototype. Whereas commercial leaders often have the big P&L for their entire drug kind of on their mind. They're thinking about omni-channel marketing and how to really drive the best outcomes for their patients across the globe. And so they don't have time to focus necessarily only on digital. So the marriage of those two groups together is really what's critical for success. And they both have different lenses and capabilities to bring to that question of how to drive the right digital product and then engagement and adoption. So we work with both, and my advice is that they work together even more to drive those outcomes effectively.
And on them working together, a more integrated model, is there an example you can share of a company or a team that's doing this well? Because is it about aligning incentives? Like, how do you get folks to do this well? An example.
Yes, great question, Chitra. We have one biopharma partner who is in the rare disease space, and we find that they have an incredible collaboration between digital and commercial. And what they've done is to really have some vision driven from the digital team. And we really started with the digital team to think through, where could they play most effectively, and then brought in the commercial team to really have the clinical perspective and the drug specific perspective, the patient perspective that would drive the outcomes that we wanted. So it really was a collaboration. Now, I'd say what they did well also was focusing on the first and biggest problem with the patients, and then moving on from there. So we designed a product that really hit the biggest challenge, and this is an at-home infusion product that the patient has to self-administer. So by hitting the most important challenge the patient faced there, we drove a really big value for the patient, and they really, by word of mouth, started using the product more and more effectively, sharing it with their friends who also had the disease. And ultimately driving, I think, about a fifth of the entire US patient population for this particular disease using this digital product. And then from an adoption perspective, if going back to your last point, we see incredible adoption because of the impact that digital product is having with our patient set. So this is on the kind of penetration into the US market, but then also into Asia and Europe as more launches are coming.
And so then what are some of the biggest challenges you see in actually scaling digital health products?
The biggest challenge on scale we see is kind of a technical side and a go-to-market side. So on the technical side, you got to have a way to break into new markets and break into new kind of regimes where regulatory could be different, quality, security, and privacy could all look different, have different regulations around it. And so by using kind of a platform that already solves for all of those challenges, you're really in a position to grow fast. And then the second component of kind of a go-to-market, how do you get into the critical folks, the critical decision makers in each of those patient experiences. So patient advocacy groups are great for that. Directly clinicians obviously have a huge impact on how and why patients do what they do. And so really working across the spectrum in almost an omni-channel way to drive the digital adoption and then outcomes is really the recipe for success that we see.
All of this requires a lot of investment. From your experience, what are effective frameworks to think about ROI on investment, whether it's investing on the sales side, go-to-market side, commercially, the therapy, drug discovery side?
Yeah, it's not cheap to make digital solutions, right? And we hear the ROI question all the time from a kind of a revenue perspective, but we also hear it from a clinical perspective. And I like to start from the clinical one, right? On the clinical side, that's what really matters here. We're talking about maybe a few $1 million when you think about the digital solution that needs to get built for an outcome that can drive tens or hundreds of millions of dollars. But it all starts with, well, what is that actually going to take the patient to change, right? And once you do that, the business models follow. We're in a point in the digital kind of maturity curve of this market that is still early. And so when I think about the opportunity, I don't want to get lost in the idea that, okay, we're going to drive $5 for every dollar of investment. I want to say, we're going to drive this patient outcome for this initial investment. And here are the steps that we're going to take to kind of mitigate the risk of getting that outcome. And then, of course, the business models follow when you're really driving real value for patients.
Dave, what's the digital health trend that you think will dominate market opportunity this year?
Great question. I think it's launch. And what I mean by that is launch of specific digital solutions that I know are coming, several of them from our portfolio this year and our partners' portfolios, which are really going to drive patient change. And I'm excited about it because it's starting to see the flip that you sometimes see in markets where there's a few people kind of dipping their toe in the water, and now kind of the laggards are starting to catch up, and you're starting to see this wholesale adoption. So this year we're going to see launches that actually drive meaningful change in patients, and that's going to be a thing that really drives additional adoption from other pharma companies who are looking in and saying, I'm not sure I'm ready yet. So I'm excited about this year's launches. They're going to drive real change for the industry.
Dave, thank you so much for joining us.
Thank you.